Hello everyone, today's topic is on pathogenesis of colon cancer. As all of you know, colonic carcinoma is a most common malignancy of gastrointestinal tract. Let's see this hereditary adenomatous polyposis coli. In this condition, there are development of numerous polyp in the colon, and this has risk of or high risk of transforming into colonic cancer. And these polyp will show loss of tumor suppressor gene called APC. This brings us to our first gene, that is APC. And I want you to remember one thing. In case of carcinoma, always tumor suppressor gene will undergo loss of function mutation, whereas proto-oncogene will undergo gain of function mutation. So as APC is a tumor suppressor gene, there is loss of function mutation in this tumor suppressor gene. Now coming to this APC. So you have to remember this APC will cause degradation of beta-catenin, and there is a soluble protein known as WNT, which after binding to this WNT receptor will prevent the APC by binding to beta-catenin and prevents its degradation. So basically APC and WNT have opposite function. APC will degrade the beta-catenin, whereas WNT will prevent the APC from degrading the beta-catenin. Now, what is this beta-catenin? So this beta-catenin, if it is present in the cell, it will translocate into nucleus, causing proliferation. So in the resting cell, suppose in the resting state, what will happen? This APC will bind to beta-catenin, forming a destruction complex and causes its degradation. So after degradation, it cannot enter the nucleus, so there is no transcription, there is no proliferation. Whereas in WNT stimulation, what will happen? WNT will go and bind to the WNT receptor, and it prevents the APC from degrading the beta-catenin. So this beta-catenin will enter the nucleus, causing proliferation. In case of colonic cancer, there is loss of function of APC. So APC cannot bind to beta-catenin. So this beta-catenin starts accumulating in the cell, and it will translocate into the nucleus, causing transcription and proliferation of cell. Another mutation which occurs during progression of cancer is KRAS mutation. So KRAS is an proto-oncogene. So what should happen? There is gain of function mutation of KRAS. So when proto-oncogene gain of function mutation, what will happen? There is promotion of growth, there is prevention of apoptosis. Both these things leads to cell survival. Similarly, the other mutations like mutation of SMAD2 and SMAD4. This SMAD2 and SMAD4, normally what they'll do, they'll encode tumor growth factor beta and inhibit the cell cycle. This is in normal condition. So it is a tumor suppressor gene. So what should happen? There is loss of function. When there is loss of function of SMAD2 and SMAD4, no one is there to inhibit the cell cycle. So there is proliferation of cell. Then T53, as all of you know, it is a tumor suppressor gene. So there is loss of function mutation which occurs in about 70 to 80% of colonic cancer, and this T53 mutation usually occurs in the later stage of colonic cancer. Microsatellite instability, this is a whole topic by itself, but to brief about microsatellite instability here. What are microsatellites? These are the short repeated sequence of DNA. Before knowing that, you have to know MMR. What is MMR? Mismatch repair gene. What are these mismatch repair gene? They are MLH1, MSH2, MSH6, PMS1 and PMS2. So what are they? What is their function? So MMR, the name itself suggests mismatch repair gene. They corrects the error occur during the DNA replication. Suppose if there is mismatch repair gene deficiency, what will happen? There is no one to correct them during DNA error. So there is accumulation of microsatellite. This is known as microsatellite instability. Now what will happen if there is microsatellite instability? Suppose these mutations are located in coding or promoter region, they encode tumor growth factor beta and pro-apoptotic protein. So there is increased proliferation and survival of cell. And in most of the cases there is frame shift mutation which occurs. Suppose in promoter region of MLH1, if there is hypermethylation, so there is decreased expression of MLH1, there is no repair function. So this also can occur, hypermethylation of MLH1. Along with that, usually mutation of BRAF oncogene is also seen. Again, telomere itself is a different topic, but to tell in brief, so this telomere is present in the chromosome. So with each cell cycle, this telomere reduces and finally there is no telomere, cell senescence or cell death occurs. Whereas this telomerase, what it will do, it will elongate the chromosome by adding this TTAGGG. So telomerase is an enzyme which will elongate the chromosomal length. So if there is presence of telomerase, suppose this in case of carcinoma, so this telomerase will add telomere. So with each cell division there is no reduction of telomere and cell continues to divide and cell survival occurs despite the repeated cell cycle. Thus, how adenoma carcinoma sequence occurs, so APC mutation, other mutations like KRAS mutation, T53 mutations, SMAD2, SMAD4 mutation, telomerase and many other genes.